In an exciting leap forward for medical science, a team of engineers has created the world's smallest pacemaker. So small, in fact, it can be injected with a syringe and dissolves naturally in the body once it has completed its task. Designed with newborns in mind, this remarkable device could dramatically improve short-term heart care following surgeries for congenital defects, offering a gentle and highly effective alternative to traditional pacing technology. Unlike conventional pacemakers, which require invasive surgery and rely on external wires that pose risks of infection, bleeding, or tissue damage, this next-generation pacemaker is activated through pulses of light and wirelessly controlled by a soft, wearable patch on the chest. The patch detects abnormal heart rhythms and sends light signals through the skin, seamlessly restoring a normal heartbeat. This combination of advanced bioengineering and non-invasive control offers not just a more elegant solution, but one with far fewer complications, especially vital for fragile newborns in their first days of life. The technology is the result of a collaboration led by Professor John A. Rogers at Northwestern University, alongside experimental cardiologist Igor Efimov. Their shared vision was to reimagine how we support the heart during its most vulnerable moments, especially in infants who often only need temporary pacing for a few critical days post-surgery. Because newborn hearts tend to recover and stabilize quickly, the pacemaker is designed to dissolve safely and entirely within the body, avoiding the need for further procedures and the associated trauma. The innovation improves on earlier versions by shrinking the size of the pacemaker even further, down to less than the size of a grain of rice. This was made possible by replacing earlier wireless control methods, such as near-field communication, with an innovative light-based system. With this refinement, the team was able to eliminate bulky components like antennas and deliver a device that can be inserted through a syringe with no incision required. Even more impressive is the way this tiny pacemaker powers itself. Rather than relying on batteries or external energy sources, the device uses a simple galvanic cell, similar to a small chemical battery, that becomes active when it comes into contact with bodily fluids. Once inside the body, the environment itself energizes the pacemaker, allowing it to respond instantly to light cues from the wearable patch. When light reaches the device, it activates a microscopic switch that powers stimulation, helping the heart maintain a healthy rhythm without any physical tether. What's truly transformative about this advancement is how it turns the body's own properties into a partner in healing. By leveraging infrared light, which naturally travels well through tissue, the wearable patch can reliably communicate with a pacemaker even though it is deep within the chest. This adds yet another layer of safety and simplicity, removing the need for any protruding components while ensuring precise control. Despite its minute size, just 1.8 millimeters wide, 3.5 millimeters long, and 1 millimeter thick, the pacemaker is powerful enough to match traditional models in performance. But because of its biocompatible materials and dissolvable design, it eliminates the need for surgical extraction. This means no follow-up surgeries, no scar tissue entanglement, and no risk of secondary complications, a particularly important benefit for vulnerable patients who are already recovering from complex heart surgeries. Looking ahead, the implications of this invention are enormous. These ultra-small pacemakers could one day be deployed in groups across different areas of the heart, each individually controlled with specific light wavelengths to provide highly customized, multi-point stimulation. This could unlock entirely new ways to treat complex arrhythmias or support recovery after other types of heart surgeries. Additionally, because the technology is both wireless and modular, it opens the door to integration with other implantable medical devices. In fact, early demonstrations have already shown success incorporating these pacemakers into existing valve replacement systems, potentially offering broader cardiac support during healing. The broader field of bioelectronic medicine stands to benefit as well. This platform of dissolvable, light-activated microdevices could eventually be adapted for a range of therapeutic uses, from aiding nerve and bone regeneration to managing chronic pain or accelerating wound healing. It marks a move toward a future where medicine works more in harmony with the body, using smarter, softer, and safer tools that leave no trace behind. What started as a solution for the smallest patients may end up shaping the future of medical care for people of all ages. This pacemaker, once a feat of science fiction, is now a stunningly real and tangible step forward, heralding a new era in how we care for the human heart.